Welcome back. I'm nurse educator Chelsea, and today I'm going to be talking about metabolic syndrome, which, if you ask me, is really an underrated diagnosis that we don't really talk about as much as we should. To be diagnosed with metabolic syndrome, 2 of the following criteria need to be met. The first criteria is dyslipidemia, which can either be elevated triglycerides or decreased HDL, which is the good cholesterol. The second criteria is hypertension, which is systolic blood pressure greater than 130. And then the third criteria is hyperglycemia, which is either a blood sugar greater than 125 on 2 different occasions or an A1C greater or equal to 6.5. And then the final criteria is abdominal obesity, which in men is more than 40 inches at the waist, or for women, it would be 35 inches at the waist. Now, I mentioned this is an underrated diagnosis. Why do I say that? I say it because about a third of Americans have metabolic syndrome, whether they know it or not. This is important because having a diagnosis of metabolic syndrome puts you at a high risk for developing cardiovascular disease or stroke, which are both leading causes of death and disability in the United States. Now, it's important to discuss with patients their diagnosis of metabolic syndrome and to educate them that their risk can be decreased through lifestyle modification and/or using medications. Thank you for coming to learn with me today. Please don't forget to rate, review, and subscribe to get the latest updates.